or broker. I represent many different carriers. And I've been licensed since 2004. I've worked with individuals. I've worked with small group company employer groups. But Medicare recently, in the last, say, 5 or 6 years, has been my sweet spot. And I really enjoy working with that group because, one, the plans are very generous. People seem to enjoy the products that are being offered to carriers like United Healthcare or Anthem or Medical Mutual. I mean, there's so many different carriers. Cigna, Humana, Devoted is a new player in this market. And some of them have dual plans that are specifically geared for people who have Medicare and Medicaid. That makes these folks eligible. We have to have both Medicare Parts A and B and Medicaid. Those are prerequisites for the dual plan. Dual meaning Medicare and Medicaid. So, I mean, there's certain criteria that actually, make me more prone to recommend one carrier over another. I mean, I do sit through presentations by these carriers. I do hear what they, each year they roll out, they have planned product rollouts, and, some rise above others. And some of the criteria that I'm looking for are, competitive plans, or the co-pays and the deductibles and the plan design, the provider networks, their resources. Are they substantial? Are they, they've been tested? Are they proven? But in these particular plans, there are really no co-pays, there's no cost sharing, there's no premiums, because Medicare and Medicaid pick up, the costs that normally people who don't have Medicaid would have, to bear. So there's a beauty to that. These are really special plans. I mean, people oftentimes ask me, or they tell me, they say they sound too good to be true. People who who don't know about dual plans. But those that have had Medicare and Medicaid for a while, they know that these plans exist, and they're familiar with the fact that not only do they offer medical, but they have ancillary benefits like vision and dental and transportation and food cards, that have really exploded. Now they're actually covering utilities and, internet, costs for internet service. So, there's all kinds of beautiful things that are being covered now that were not a year or two ago. So, I mean, I'm trying to, I just want to present these plans, and I want to answer your questions. I'm sure some of you have questions, but just keep in mind, I mean, I'm a little bit biased when it comes to certain carriers. I have 3 that I recommend more than others, but I do that because they're large, they have economies of scale, they have tremendous resources, they have committed themselves to investing in their provider networks. They have great customer service.
Right.
All these things bode well for me because people don't like disruption. I mean, when you buy they don't like disruption. So, if they're going to go from one plan to another plan, they want to know that things are, not going to create, headaches. Are their providers going to be in network? Are they going to have the same benefits that they had before? Or do they, maybe even more benefits? What else can I say? What can I say to, I'm trying to think what else I can tell you. I'm not, I do really well at kitchen tables and people's homes and in coffee shops. I think that's where Debbie and I met, was at a Starbucks. But, 9 times out of 10, I'm usually sitting in someone's kitchen or their living room, or we're meeting in a common area, maybe a library, and we're going through, their eligibility. Are they eligible for these plans? And, what their needs are. A lot of these plans pay for prescription drugs. I mean, there's zero cost. There for the formulary. These formularies have over 350 to 400 drugs, and if their drugs are on the formulary, they're covered at 100%. So there's really little, if any, cost sharing. There's no copay. There's no premiums because Medicare and Medicaid pick up the tab. What they do offer is a ton of things like dental. United Healthcare, for instance, and I'm going to talk about United Healthcare a lot because I really think they're the leader in this market. And it's not because I get paid more to sell United Healthcare, but it goes back to my point about disruption. There's very little disruption with a carrier like United Healthcare. They have a great plan design. They have great customer service. And so, for me, it's an easy plan to sell. It pretty much sells itself. All I have to do is present the benefits. And so, people who've never been exposed to this, like Debbie, she was a little skeptical. She was one of those people that thought it was too good to be true. But like I said, there's a lot of people that I work with in Euclid, in low-income senior housing facilities. They're familiar with these dual plans. I mean, they know, they've had them. They're pretty knowledgeable. So really for them, I only have to tell them, look, this new plan, it's got $230 food card that you can use for over-the-counter products or internet service, utility bills. It's wonderful. You go to Walmart, Giant Eagle, CVS, it's a debit card, and they love that. It's probably the most of any of the other carriers offer $230 a month, but they also offer, dental, $4,000 in dental coverage, $550 for lenses and frames for vision coverage. I mentioned that they pay the prescription drugs. They have gym memberships. They have acupuncture. They have foot care. I mean, they have transportation, 84 rides. So the list goes on. And there's other carriers that have similar offerings, they're just not as rich. So that's why I like to work with United Healthcare. But look at if your providers weren't in that network, and most of them are, I usually tell people that if you can't find your providers in these networks, I'll take you to lunch. And there's very few people that I ever take to lunch on that promise. We took Debbie to Starbucks for coffee, but that's okay. That was for, it was just a place to meet. So again, I mean, I would look forward to maybe answering some questions. I mean, at this point,
Brian,
I don't want to be redundant. I don't want to go back over the same things. Go ahead. Yes.
so I thought maybe you could talk about how they qualify for a dual program, show the visuals of what things are covered, at least under United Healthcare,
Okay.
and talk about the process about how you checked out all my doctors for my kids because I was reluctant to sign up for the one plan. And you said, Cleveland is a great place because all the Cleveland Clinic, UH, and Metro doctors accept this. So
Correct.
if you want to talk about those 3 steps and show what you have, I know people already have comments and questions, but I'd like you to lay it out first.
Yeah. Okay. So first of all, not every provider, I will never promise you and say, even though the Cleveland Clinic and University Hospitals and Metro Health are in the provider networks, I would never tell someone that just because the Cleveland Clinic's in the network, that all their doctors are in network. It doesn't work that way. But I will tell you that there's a ton of them that are, and I'm willing to check and prove to you that your doctor, your children's doctors are in this provider network. Because there is a directory, you can go online. I can go online and I can research those for you. Just like I can research your prescription drugs to assure you that they're on the drug formulary. But that's one thing that makes United Healthcare a strong competitor in this marketplace, is that their provider network is so strong. Let me just, I'm gonna flip over, I'm gonna share my screen on something here. This is the dual plan. There's actually 3 dual plans, but let's focus on this one on the far left column, because that's for Cuyahoga County. It's the H 5253059, and that's for fully dual eligible. So you can see right from the start, the plan premium and all the copays are 0, okay? So there's no referrals to see specialists like there are in some other carrier providers. And, you know, all the copays are 0 because Medicare and Medicaid pays these what would normally be copay. So also the prescription drugs at 0 copay. Whether you have a 30-day supply and you pick those up at a retail store or you mail order them. I mean, a lot of people mail order drugs that are maintenance drugs that are ordered every month. You could order a 90 or 100-day supply and get those for 0 copay. The things that people really get excited about were those that I mentioned briefly. I think the top attention getter is this $230 a month food card, which is also something you can use for over-the-counter products like first aid, pain relief medications, cold and flu, vitamins, skin care, diabetic care. I mean, there's just a huge, there's many options that $230 can be applied toward. And it's on a U card. There's these U cards that come out. It's like a medical card, but it does all these things. You can take it to the, you know, the Walgreens or the CVS's. You take it to your dentist. You take it to your vision providers. You take it to the gym. There's gym memberships included in these plans. You know, the YMC, local rec centers, Lifetime Fitness, Planet Fitness. I mean, they're just, it's wonderful. It's really wonderful. As we go down through the food and utility OTC card, go past the dental benefits, the routine transportation, 84 one-way rides that you can use to take you to the gym. You can take it to the pharmacy. It'll take you up to 60 miles. So if you've got a provider that's 60 miles away, you know, that's as far as Warren. You know, it's included in this plan. So most people don't travel that far, but it's nice to know that that's an option. That's built into the plan. So routine vision benefits, 0 copays for eye exams. This year it's $550 for eyewear. That's amazing. I mean, it's a lot of money for people who normally, you know, wear the Wally Beaver black rim glasses. You know, that $550 can buy a nice pair of titanium frames with top of the line lenses. Routine hearing benefits, they give you $3,600 allowance for hearing aids. And here's the fitness benefit, which they call Renew Active. And again, that's YMCA, rec centers, Lifetime Fitness, and there's a whole slew of them. But a lot of people enjoy that benefit as well. What else do we have? There's the routine foot care. I didn't list everything because I'm limited. But this is a lot of the benefits that are mostly, you know, people are mostly interested in. And this particular plan is for folks in Cuyahoga County, United Healthcare Dual Complete. We call it the LP. So these are the counties that plan is servicing. And then, you know, if you're in another Lorraine or Medina, there's another plan. It's not as rich as the LP. And then there's a dual complete choice for other counties as well. But I would say 95 out of 100 times the LP plan is the plan that I'm promoting, because a lot of my folks are in Cuyahoga or Summit County. So that's that. I don't know what else I could show you. I have summary of benefits. I have explanation of certificates of coverage. I mean, they're hundreds of pages long. I could email it to anyone so they could have a real granular information. But this is pretty much an overview of what these dual plans look like. They all have a plan component. They all have prescription drug components, and they all have extra benefits and, feature component. This just happens to be the richest plan that I would recommend, initially. If the providers weren't in this network, or there was something about it that was, not what, it just wasn't what you wanted, you can look at other carriers. But I find United Healthcare most of the time, I would say 90% of the time, I can find a client who likes this plan and never leave. I mean, they usually stay with it. People have stayed with United Healthcare for years.
Brian, do you have the a visual of the OTC products that are available for that $230 a month?
I think I do. Let's see. Trying to see how to get. I'm trying to, you know what? Let me just pull it up. I'm just going to pull it up.
Okay.
I mean, I got it somewhere, but. Okay, so the catalog, let's look at the catalog. So this is a 48-page catalog, and it shows you basically, let's open it up. How do we go to page 2? Let's scroll down. So these are some of the things you could expect to find with your debit card. Okay, you be able to get fresh food. They've listed all these wonderful things that people can buy: frozen meals, salad kits, dairy products, meat and seafood. And I mean seafood. I mean, you can get shrimp and lobster. I mean, it's amazing. Fresh meat, chicken, poultry. I mean, dairy products. It's really expansive. I mean, I tell people, and they usually laugh, I say there's no cigarettes and beer, okay? No chip, no things like donuts, but you never know. I mean, maybe some Edam's donuts could actually pass through. I don't know. But if you stick to this list of, fresh frozen and canned fruits, or fresh frozen and canned vegetables, frozen meats, you'll be fine. You can also purchase over-the-counter products, vitamins, Band-Aid, toothpaste, Listerine. You can either walk right into the store, or you can order them online. Utilities, which is new this year. You pay your electricity, your gas bill, heats, water, sewer. As long as those companies accept this debit card, you can use it to pay those statements, which is wonderful. But, $230 is the limit, and you can use it any way you want across the board. You want to use it all on your utilities? Fine. You want to use it all on food? That's fine too. Hold on one second. Be right back. I got to let my cat in.
Well, while he's gone, just to let you know that if you use it for utilities, the utilities have to be in your person's name. So,
Yeah.
if they're living on their own and the utility is in their name, then it will be covered. But if they're living at your house and the utility is in your name, it will not be covered.
So I can scroll down a little bit further. It just gets a little bit more granular. It gives you, detailed information on how to use your utility, or how to pay your utility bills, or how to purchase, using the card, in store, online, by phone. And then it goes into, list. This is just a catalog of, some of the items. This is not all the items that are available online, but, some people that have incontinence issues, they order their Depend, or they order, their salves or creams, or, whatever it is. I mean, this is just an overview of some of the products. And this is just an example of what the catalog looks like. There's a mix, cold medicine, allergy relief,
Yeah.
vitamins. There's durable medical equipment.
No, I'm not.
There's walkers, look at this, shower heads, toilet seat risers, all kinds of things, ace bandages. These are things that people, they utilize and they're familiar with. Let me know if I'm going too fast, but, antacids. Again, it's just a brief overview. It's just, eye and ear care. You'll probably find more items in the store, but just an example. First aid, foot care, home tests and monitoring equipment for diabetics. Some of these are really nice. I always tell people if they don't use all their benefits, they should let me utilize them, because I always wanted one of these sports watches, or a blood pressure analyzer, or a thermometer. There's never a thermometer when you need one. And they can be for anybody in the house. This isn't just for that particular member. So I think that the goal here with the carriers are that they want to improve their members' health. And so we offer a lot of these benefits. And, quite frankly, the government pays them to administrate these plans. And people who are dual eligible receive from the government, the carrier, United Healthcare, receives about $1,400 a month to support these individuals. And so companies like United Healthcare, they create these plans. And this is what you see. This is the byproduct of the money that they give them to administer these plans. The dental, the vision, the over-the-counter, the medical. It's all to improve their members' health. And if they can improve their health, we're improving, our society's health. So it's a wonderful program. It's great that they offer these things.
Is there anything else you wanted to share with us? Should we start questions?
Yeah, I mean, I'm fine with questions. I think sometimes we learn, even I learn a few things from people's questions, and sure.
Do you want to stop your sharing then?
Oh, stop sharing.
You ain't know?
Okay, got me back.
Okay, I'm gonna tell you what questions were in the chat first, and then after we answer those questions, then we can just take questions from, anyone that has one.
Okay.
So this started up at the top. I don't know if you see the chat, Brian, but Jill asked, will you be talking about MyCare Ohio? She was
I can
told
talk.
she had-
Okay, so I'll hit MyCare Ohio just for a second, okay? Medicare Ohio, I think they would like to administrate the Medicaid and Medicare, okay? Now, it doesn't work well with this plan, so how do I explain this? What I have people do is they opt out of the Medicare, and I just want to make this really clear. If you have Medicare Ohio, and again, people who have Medicare Ohio, some of them have a lot of needs, okay? And if they're those kinds of folks that have a lot of needs, let's say I mean, these are people that can't function independently, okay? And I usually can spot them when I walk into someone's house. They have a high level of care. Then I usually leave them where they're at. I let Medicare Ohio administrate the Medicare, Medicaid, and all the resources that those individuals require. But I've met people who have Medicare Ohio that are completely independent. They drive, they're fully functional. What I ask them to do is opt out of Medicare, the Medicare piece of Medicare Ohio, and let United Healthcare administrate that, okay? And there's a form we can fill out to administrate the Medicare Ohio piece of the Medicare. So they're opting.
She said that she was in the the United Healthcare Dual Complete, and then they took her out and put her in the community plan, which was not as good. Should she
Correct.
meet with you privately about this?
Yes, because I have the form that you can use to opt out. Now, again, those are people that are functional. They don't need, all the resources because look at it this way. You're getting a better plan with United Healthcare because how do I explain this? There's more money available to United Healthcare to spend on that program, just like Medicare Ohio gets that money. So they're spending that money on the resources that these people may need. That's why their plan might not be as generous because they're getting other resources. They're not getting a $230 food card, but they're getting home health care providers who might be there, 4, 6, 8 hours a day. So it's a trade-off. And if what it is that you need is the home health care, then go with Medicare Ohio. But if that's not what you need, and you prefer to get the richer benefit available through United Healthcare, then opt out of that. And I have that form. So they won't keep bringing you back in because they kind of sweep those people back in if they don't opt out. There is a form that they send to people every year, and some people don't see that form, or they overlook it, or it gets lost in the mail. So what happens is Medicare Ohio sweeps them back in. And so I don't know how long that's going to last, but they do serve a purpose. Medicare Ohio does offer, a good deal of services for those that need it. I hope that answers your question.
Jill, do you want me to just put you in touch with Brian directly? She's muted. Okay.
Well, that's fine. It's not everybody has Medicare Ohio. Not everybody gets swept into that.
Okay. And also she wrote that she'd only gotten $130 a month when she was under the dual plan, but they've raised it this year.
Yeah,
for sure.
It was $195 last year, or no, it was $175. Now it's $230.
Yeah. Yeah.
So it's great. A lot of people were shocked. United Healthcare really put their money, where their mouth was, and they made it very flexible. So it's not just for food, it's for over the counter and utilities. So
And it doesn't impact any of the SNAP benefits, and it doesn't impact any waiver services.
no. Anything else that you might be getting from, social services, does not interfere with it all.
Okay, Dave and Cindy asked, are you familiar with Medicare Advantage plans that are offered by companies as part of retirement benefits? So
Well,
go ahead.
okay, yeah, I am. And if it's offered by a company, if it's an employer group retiree plan, those, I actually worked with consultants to design those plans, but keep in mind, they're individual, okay? They're individual by employer. So an employer can design a plan, to fit a retiree population, okay? So each one of those can be different. Now, if you're entitled to a group retirement Medicare Advantage plan, you might want to keep it. I mean, I don't know if you're talking about supplements or whether you're talking about Medicare Advantage plans, but sometimes they're really good and sometimes they're just okay. The state teacher retirement system, it's okay. It's not great, but I usually can compare it to other Medicare Advantage plans that are available that are almost as good. It depends what your personal needs are.
That's you, Cindy, you're on.
Yeah.
Yeah.
Could I, Dave had another question, if we could take another
that's
minute.
related to this, that we heard initially that when I retire, like my daughter would have to wait 2 years to get on Medicare. But Sherwin-Williams told me that they have pre-Medicare for those 2 years until she can get on Medicare. Could you talk about that? Is that generally true?
I wouldn't say generally, it sounds like it's a Sherwin-Williams packaged offering. But yeah, usually the waiting time because look at who's eligible for Medicare, people who turn 65 and people with disabilities. And some of the people with disabilities get a Medicare immediately. Some of them have a 2-year waiting period. So a 24-month waiting period. So it sounds, there's some of that that's reflected in what you're telling me. The 24-month waiting period might be, based on, eligibility. But it also sounds like they've got some kind of resources that, are geared specifically for that population. Folks with disability.
Maybe we'd like to meet with you too,
Yeah,
and then,
Because it was also spouses, I thought that that Cindy was the same way, that she'd have to wait, or was it for her too? I forget, but at any rate, yeah, they had a pre-Medicare plan that would fill in, because otherwise you'd be on, like she'd be on my plan and Medicaid, but then for 2 years she'd just be on Medicaid, but instead they have the pre-Medicare plan to fill that gap in.
Okay, so let's take that offline because that's very individual case and there's a lot of factors. I mean, it sounds like Sherwin-Williams could tell you if their HR people are skilled in that area. I mean, they could tell you specifically what to expect and what, the parameters on that program are for, for the employer group, retiree group plan. But I have some knowledge in that. I mean, I'd be happy to tell you what I know.
Yeah,
yeah,
okay.
thank you.
that'd
We'll
be
get your
great. Thanks.
information. Thanks.
Yeah, I'm collecting the names of people that want to follow up on this after this with Brian, so I can send a group email so everyone has the information that they need. The next question is from Mary Lynn, and she said her daughter's 21 and they have her on their health insurance plan with work. She's also been assigned Medicare and Medicaid plans. So does it make sense to keep her on the work plan for a couple more years before we have to drop her because of age, as well as having Medicare and Medicaid, or just use Medicare and Medicaid?
Okay,
That's
so
a
that's
good
got
question.
some.
'Cause that
that's a-
happened to all of us before we
Okay, so that's
retired.
a great question, okay? And it's got some interesting dynamics to it, but I would bet, okay? I mean, she has this, well, she can stay on your employer or your company plan until she's 26 in the state of Ohio. But in any event, I guarantee that the dual plans that are available are gonna be worlds better, I mean, 1,000 times better than the employer group plan. And so I would lend a lot of credibility to taking her off the employer plan and putting her on, if she's Medicare and Medicaid eligible. I don't see any reason why not to. There's just no reason. I mean, these plans are so rich and they offer so many great benefits. I mean, there's no copays, there's no co-insurance, there's no deductibles. I mean, your employer group plan has got all three of those things. I guarantee you.
But the
Plus,
Medicare, Medicaid covers all those deductibles when we did it. It was the employer plan, Medicare, Medicaid were secondary. And so we had no deductibles either. And the dental and vision, except dental and vision, because that's the difference between what you're offering.
Well, any of these dual plans, they offer not just dental and vision, but, transportation, pay
Yeah.
for all your prescription drugs, give you a food card for, for hundreds of dollars a month. All the ancillary benefits, that's just not available through that employer group plan. Regardless, even if they do pay for the premiums and the co-pays and whatever. I mean, it's just rich with all these other benefits. It's a head turner. I mean, it's worth consideration.
Jill also asked what determines which of the 3 plans you get on. And I'm assuming that means like the POS and the PPO and the H.
Well, okay, so the first thing is the county. It's by county. Okay. So if you're in Cuyahoga County, you're gonna have the richest plan. For some reason, that plan is the richest. There may be instances where you want a PPO plan because your provider might not be in the network, and it might be in the network in the PPO plan. But I haven't had anyone subscribe to the PPO plan. I mean, everybody I've found has providers that are in the network. Signature Health, for some of their mental health providers, there was some disruption there, but I haven't seen that recently. But that's about the only one I can speak to. Signature Health and their mental health providers and social workers. Some of them were not in network. And so there was a change with how they were administrating these plans. So, I mean, we'll look. All I can tell you is that we'll look. If you have providers that, that you want to keep, then, you just have to look and see if they're in the network or not.
And I had asked you, Brian, what happens if I take on a new provider that's not in the network? And you pointed out that we have the ability to change plans. We don't have to wait for enrollment periods.
Right. So, everybody else has these enrollment periods, but people that have dual eligibility, they have what's called a special enrollment period. And there used to be the ability to switch every month, and they tightened that up a little bit to quarterly. So now, if you are dual eligible, after 3 months, if you don't like the plan you're in, you can switch back to whatever it is you had before, or whatever other plan is available. But again, most people don't switch when you're not in healthcare. There's some caveats with employer groups that once you leave, you can't go back, but that's really for the employee. I don't know if that's true with children. I don't think that's true with dependents. I think if they have a qualifying event, they can switch, they can come back to the employer group plan.
Okay, Jill, it's a different Jill, said, how do you know if you're on this or not? If I understand correctly, my son is both Medicare and Medicaid. He has 2 cards, Medicare and Buckeye Health as his Medicaid, but she never knew about these extras. The only thing that they've had to pay for is dental, mainly because it's hard to find someone to take his insurance. So they've just paid out of pocket for that. But
Well,
that's kind of like where we were before we met you.
Well, first of all, I mean, I meet a lot of people that have Buckeye and CareSource, and most of the time I ask them, and I don't want to be flippant with anybody, but I just say why. Because if you compare those plans to the United Healthcare plans, it's just so much more robust in so many different ways, not just in the plan design, but in the provider networks and the customer service. I mean, the hold times for United Healthcare are just so much less than some of these other carriers. Customer service is higher quality. They're not perfect, but I think they're more perfect than others. So, you know, if you're with Buckeye, you know, that's not a United Healthcare. I mean, United Healthcare is number 5 in the Fortune 500 list. I mean, they're the 800-pound gorilla. They bring to the table tremendous resources. And these plans reflect that. So, you know, if you want to assign your Medicare to anyone, I mean, United Healthcare is the top of my list. Anthem is probably number 2. Devoted might be number 3, but I certainly don't put CareSource or Buckeye in anywhere near the top. Not at all.
So like in our case, we had the exact same plan that Jill's talking about, but then we went with you. And so we still have Medicare and Medicaid cards that we carry, but when we go to the doctor, we hand the United Healthcare card to them.
Correct.
And, you know, and if I have issues, I always text Brian, but I've never had an issue where that's concerned.
Well, what's really nice is this year, and this is an electronic thing, that they were able to come out with this U card, and the U stands for universal. And the one card, it does everything. So not only do you give it to your doctor when you go to doctor visits, your primary care, your specialist, you give it to the pharmacy to get prescription drugs. You give it to the dentist to get your dental coverage. You give it to the eye care provider. You give it to the gym. So, you know, so you can, you know, you have a gym membership. I mean, it's amazing. There's one card. Everybody accepts that card. It has multi purposes.
Cindy
Really
and Dave,
amazing.
I'm sorry.
No,
Cindy
it's
and Dave,
amazing. I mean, it's crazy. I mean, it's new technology. We never had this before.
no. Cindy and Dave, you have this question about how long it would take for Maddie to qualify, but was that answered already?
Yeah, let's see.
Said, how do you qualify? How long does it take to apply? When?
Okay, so here,
Yeah, when
this
do
is
you
the,
apply? That's all.
this is kind of the enrollment process. If I was sitting down with you and they said, oh, this is great. I mean, I want to sign up right away. I would say, okay, fill out, you know, an enrollment form. Coverage starts the 1st of the following month. Okay, so today is what, the 7th, February 7th? So anybody that would sign up in February would have coverage effective March 1st. I mean, they might not get their cards March 1st if they signed up February 28th, but they would be enrolled. They would have a Medicare, United Healthcare, or whoever, member ID number. They could access the medical delivery system. They just wouldn't have their card until their card was actually delivered.
And the card took us a while to go into effect anyway. It did take longer than, we weren't able to start it till January 1st, even though our healthcare coverage started December 1st. The OTC stuff didn't start right away, but I think that was a glitch in the system.
It was. And you know what? There were glitches with these new cards. And it wasn't just with one carrier. They all adopted this new technology. A lot of them, I shouldn't say they all, but the major players adopted these U cards, and they had printing errors. I mean, they had, you know, there's still some problems with the barcodes. So it's not perfect, but we're getting through it.
Cindy and Dave, did we answer your question?
Yes, I think we can talk to Brian about a couple things, but yeah, I think that's good for now.
Thanks.
Okay. Lori, you asked how you switched from the plan we're on to this one. Did he just explain it, or did you want more details?
Oh, well, I can tell you it's pretty seamless, okay? These requests, these enrollment forms, this is the handshake. This is how it works behind the scenes. The application goes to the carrier. The carrier reaches, they scan it, they proof it, they make sure that all the information's there that's needed. And then they send it to Medicare, or the Center for Medicare Services. They look at it, and if the application meets their criteria, they give it a check mark, and they send it back to the carrier. And the carrier says, okay, you know, we've gotten approval on this application, and we're gonna go ahead and, create a member ID number. We're gonna send out a welcome kit. And so that's the handshake, is it goes from the carrier to CMS, or Center for Medicare Services, and then it goes back to the carrier. It's about a 3 or 4 day process. Sometimes it takes more time. It just depends.
So let me ask you this question. We're in the process of applying for SSDI for one of my sons on his own work record. So I'm assuming if he gets accepted for that, then he would be eligible for Medicare as well, correct?
Okay, so it's SSDI,
Yeah.
Social Security Disability Insurance? or-
Yes.
okay. So,
He's,
again,
go
if he's got Medicare Parts A and B, okay?
he doesn't
will.
have it yet.
But I'm saying, when he does.
Okay.
When he does, he's got a red,
Okay.
white, and blue Medicare
Yes.
card. It's got the, let's see, 11-digit alphanumeric number. He's got Parts A and B effective dates, and he's got Medicaid.
Yes.
And he's fully eligible for Medicaid, not partially eligible. There are plans for folks that are partially eligible too. They're just not as rich, okay? They're not as rich as the fully dual eligible. So that's getting a little bit more granular, but let's say he is fully dual eligible. He would be entitled to this and other plans like this, the dual
Okay.
special needs plan.
Okay, he's on CareSource right now. Would it make more sense to switch to United Healthcare now, or just wait and then do all of it together?
So he's with CareSource and he's got Medicare Parts A and B.
No, he does not have Medicare yet,
So you
but,
can't
Okay.
switch until you're eligible.
well, he has CareSource Medicaid. That's all he
Well,
has.
that's not enough. He's
Okay,
got to have Medicare. A lot of
Right.
people, they want it, but they're not eligible.
right. But would it be easier if I just switched the CareSource to United Healthcare now?
Does United
No,
Healthcare do a Medicaid?
No, just the
She's just saying her
community plan.
Medicaid.
Community plan.
It's
It
6 of
doesn't
one and a
matter.
half a dozen of the other.
Okay.
It's,
Okay,
let me just say something. There's a lot of people that are just Medicaid eligible. They just have
Mhm.
Medicaid. And they
Yeah.
love their CareSource. CareSource takes good care of them, okay? And they
Yeah.
won't switch. They won't switch to United Healthcare. So I can't speak to that because, I only represent the folks that are on the dual eligible plan. And to them, there's a difference, okay?
Mm.
Whatever that is. I don't know specifically, it might be their providers. It might be, their hospitals that they go to, their medical centers. But you can't get them to switch from CareSource. They're embedded.
yeah.
And it's
We've
okay.
not- Yeah, we've not had any issue. We got assigned to CareSource way back when. We haven't had any issues. My other son has United Healthcare Community Plan, and I've had no issues with that either. I didn't switch from CareSource just because we were fine and his doctor takes it and I didn't have any issues, but I would like, when he does become eligible for Medicare, I would like to switch to what you're talking about.
Well, just so you know, I mean, I speak very highly of United Healthcare and for good reasons, but they're not the only carrier. There's other carriers and some of them are very good, for certain people. And again, I don't want to make their lives disrupted by changing those plans. It's
Okay.
just, United Healthcare is a good option. It's a strong option. And the people who aren't aware of these plans are aware of what they offer. It's an eye opener. I mean, like Debbie, she was shocked. I don't think, she was very skeptical. And I
always am.
asked her to trust me. And fortunately, the proof is in the pudding. It worked out well.
I also had Brian Weiss interrogate you so that I could know if there was any fault that I didn't see.
She interrogated me pretty good, but it's okay because, I understand people want to know, and this isn't something you want to mess around with. People's lives are at stake. They have, providers that they rely on and that they, take good care of them.
Well,
So
it's easy to be distrustful because of the experiences most of us as family members, siblings and parents have had with all these medical insurances and Ohio Jobs and Family Services and everything else. So,
Well, the other thing is too, turn on the TV. I mean, I could turn on the TV right now and you'll see a Medicare commercial where they're promising people everything. They're saying, just call us. We have everything. Zero copay, zero premiums. It's all included. And people call me and they say, what are they talking about? And I said, it's a call center. They're just throwing it out there. Until you give them your zip code and your information, they don't even know what you're eligible for. But, this marketing is out of control. So
okay.
it pays to take time to people and find out what they're really eligible for. And then, you go through it methodically.
Yeah.
Those are
And
the least, those are the best fits. Those are the ones where, people are happiest because you've taken the time to really make sure that there is no disruption.
Jill pointed out that you could shop at Giant Eagle, Walgreens, and Walmart. Walmart delivered same day to us, which blew my mind. But the money, and this is a good point, Jill, it does not roll over every month. So if you don't use it, you start over the following month anyway. So
Yeah, there's some plans, not on the dual side, but they're on the other Medicare Advantage side where they do roll over, but not in this world. In this world, they don't. So it's use it or lose it.
we don't have to claim any of those benefits on our kids' taxes, do we? Like if they're getting,
I don't think so. I don't think so. No, I've never
It's
heard
like-
that.
yeah. Okay, that was a question I had never considered. I think that's a good question.
Well,
okay.
how do they know how much of it you use, really? I mean,
Yeah, I don't know.
no, I would have to say no. I would say with a 99.9% certainty that that's not the case. It's not taxable. It's not looked at as income.
Not yet. Or in-kind support. Yeah,
Shh, don't say anything.
okay.
Hopefully they're not listening.
Lee and Debbie said that their son's been on Medicare for years, but they changed his Medicaid coverage this year. So is there a question that you have for Brian about that, Lee and Debbie?
Yeah, if you would go down farther, we were curious about, because he's been on Medicaid and Medicare, they switched his plan this year to Cigna. And for prescription coverage, we're curious as to whether or not we can change that and into the United Health Plan. What's the monthly cost of that for him? And then how does that play into his other coverages?
So let me ask you a question. He has Medicare Parts A and B, correct?
Yes, sir.
And he's got Medicaid as well.
Correct.
So Cigna has a dual plan. I don't think it's as rich as United Healthcare. United Healthcare pays for all the prescription drugs that are on the formulary. When you say they switched you.
Yeah. You received
mean-
a notice.
Well, I don't know why Cigna. I've never heard that about Cigna, but occasionally they do switch people from United Healthcare to Buckeye or to CareSource, but I never heard them switching someone to
The
Cigna.
drug plans switch all the time. Every year we used to be switched to a different drug plan, drug carrier.
Well, I mean, you can take control of that. I mean, you can, I mean, it's up to you as to who your provider to be. I mean, I don't think that's something that you don't have a say in.
Well, they wanted to know if they could switch him into this United Healthcare plan.
We're
Why
in
not?
Summit County.
And what's the cost?
There's no cost, there's no premium. I only brought the one book with me at this point, but if you're in Summit County is the LP. So there's no premium cost It's everything that we just talked about. Summit County
Okay.
is in the LP
Right,
plan.
okay.
So I
So
can
yeah,
put you
you're in
in
luck.
touch.
You're in luck. That's a good thing.
Thank you. Thank you.
All right, cool.
Jill asked a question called and said, is Brian fiduciary? I don't know what that means exactly.
I don't think that applies in our world, in the insurance agent's world. It applies in the financial marketplace where people are managing people's financial assets. But the term fiduciary isn't used in health insurance.
Tina pointed out that she went to her employer to keep her son on the plan beyond 26 years and talk to HR. That's what I did before I retired. But once I retired, my plan wasn't covering him anymore. And so, or them, because I have two, wasn't covering them anymore. And that's when I started considering the dual plan. So, so Mary Lynn asked what's the best website to use to do that comparison research on the available plans that are covered by both.
Okay, go
dual
to
plan.
Medicare.gov.
And then what do you put in when you do that?
Well, you
You
put in your
search
zip,
dual
you
plans?
put in your zip code, yeah.
Okay,
I mean, look at, when you do that, when you go online, it's gonna be really high level, like it's a 30,000-foot level. There's no tools that are gonna give you the granularity of these plans in really deep detail, unless you go to their websites, okay? You have to go to each carrier's website, look up the dual plan, and then, look for the summary of benefits.
that's what I did.
It's not out there. I mean, you could go to Medicare.gov and you could do a comparison of these plans, but it won't get granular. It won't go into it won't tell you how much coverage you have for the food card. It won't tell you how much you get for dental. It won't tell you, it'll just say it has dental. It'll just say, it has vision. It'll say they have transportation. So I'm not discouraging you from looking, but I don't think you'll find the granularity that you're looking for. And it might be frustrating. I mean, if you call me, I'll tell you what those plans are, in granularity. I mean, I'll be happy to. Because quite frankly, United Healthcare again in 2023 is a standout.
Jill said that she lives in Ottawa County. Do they have to wait till open enrollment to change their plan?
No,
What's
it's not county specific. It doesn't matter what county you live in. It depends on, each quarter you have an enrollment, they call it an SEP, a special enrollment period.
No, I'm sorry to interrupt, Brian, but I think she's talking about if she wants to get out of the current plan and get a dual plan, she wants one that applies in Ottawa County. Does she have to wait to anything special to just interrupt those services, any special time, or can she sign on for a dual
No,
plan?
she would have, it's called, I mean, there's a lot of special enrollment period, like nomenclature, but the one that she would use is called maintaining. She's just maintaining for Medicare and Medicaid, and she wants to switch to another plan. So every quarter, she has one opportunity to switch. So she could use the January, February, March SEP for dual eligibles to switch. I mean, I don't want to get too detailed, but yeah, she could switch.
Okay, Kat said she's usually pretty skeptical of insurance, but her experience with the dual plan at United Healthcare has been really positive so far. They did have one provider stop accepting it. That's surprising to me. But otherwise, it's been great.
Great, you got a testimonial. You got two
Yeah.
testimonials.
And then Nancy said, is this plan, what's available in Geauga? How does this compare to the HUMA plan?
Suma.
Okay, she wrote HUMA, but maybe she meant SUMA.
Okay, how does it compare? It's Well, you can't compare SUMA, an Akron-based hospital system, to United Healthcare. That's like comparing a Hot Wheel that goes on a little orange track to a Rolls Royce. I mean, they're two completely different vehicles. They're two completely different medical delivery systems. One is national in scope and, in depth and breadth, and the other one's just a local hospital delivery system, SUMA. I don't even know if they have a dual plan, if that's who we're talking about.
I think she meant Humana.
Oh, okay, so how's
Thank you, Lori.
Okay, so how does it compare? Again, United Healthcare is a much bigger player. I think they have better customer service. I think their resources are more expansive. I think that their plans are more generous. I have no problems selling United Healthcare to Humana. United Healthcare wins every time. I mean, most of the time.
So here's a really good question. Her Kat's sister lives in Mahoning County, but she's moving to Cuyahoga. She's already on the United Healthcare dual plan, but is she going to have to change what kind of plan she's on if she moves to Cuyahoga?
No, if she's got a dual plan, well, if she's got this dual plan, I mean, I don't know if she's on Medicare, Ohio, but if she's got that.
No, she's on the United Healthcare dual plan.
Okay, fine. Mahoning and Cuyahoga are in the same service area. But she doesn't have to change anything.
Okay. All right. I think that's all the questions in the chat. If anyone else has a question. Oh, Matt just added one. Let's see. His family recently moved from California to Ohio. He had medical in California. And then when they went to Social Security here, the Social Security office, they told him to enroll in Medicaid, which was approved. That part is true. But Medicare is a different story. So Matt, you're going to have to possibly explain a little bit more in depth.
Okay,
Again,
so
I mean, Medicare and Medicaid, you have to have parts A and B of Medicare and be fully eligible for Medicaid, and you're good to go.
all right, so you can hear me?
Yes.
Okay, so basically it wasn't he had Medi-Cal in California through Social Security. So when we came here, I went into the Social Security office and they told me that he should apply to Medicaid here in Ohio, but they never said he was eligible for Medicare. Now, he's been disabled since birth. Is that a normal thing? Because we didn't need it in California because California had their own little thing.
Well, Medicare is a federal program. Medicaid is a state program.
Right,
If you got, so you're saying you didn't need Medicare in California.
because
that
it was
you're-
all lumped into Medi-Cal.
Well, now that you're in Ohio, you need to apply for Medicare.
But if he doesn't have work credits, then he won't get Medicare unless his father's or one of his parents is retired or
Okay.
even deceased. They have to have SSDI to qualify for
Okay.
Medicare.
Okay, so the reason we moved to Ohio was that my wife passed last year.
Okay.
So would that make him eligible?
So if we've been through that ourselves as well. So if your wife passed and she had money in Social Security, once she passed, did he get survivor benefits?
That's what he's collecting right now, survivor benefits. They
Then-
switched him from SSI to
To
survivor.
SSDI?
Well, they switched him, yeah, from whatever it was, Social Security, he's now on survivor benefits.
Okay, with those survivor benefits, he should qualify for Medicare. Because that is, the survivor benefits, I think, come through SSDI as well. But I think he qualifies for Medicare based on that. And once he qualifies for Medicare, then he will qualify for one of these dual programs. I'm not an expert. I'm just speaking
Okay.
from my personal experience. But if you go to the Social Security office, you would still need Medicaid, of course, but
Right.
you could talk to them about getting the SSDI. And then, you know, if you see on any of the statements you've gotten, that he is already qualified for SSDI, then you can just go ahead and apply for the Medicare.
Well, they told us that he would not be getting the disability anymore because the survivors pays more.
Okay, so that part is true, but even if he doesn't get, so my daughter, her father died,
Uh-huh.
and she had the exact same thing. She qualifies for SSDI, but she doesn't get SSDI. She gets the survivor benefit. But
Okay.
because she qualifies for SSDI, she qualifies for Medicare.
Okay, so I'll go back in and hit them up on that one.
Yeah, it's real complicated, and I apologize, and I wish I had, you know, more knowledge about it, but I know that I've had to go back to that office 4 and 5 times to get everything that she was supposed to get.
Okay, great. Thank you.
Are there any other questions? I'm going to put Brian's contact information in the chat so you can reach out to him if you need to. But if you have any other questions, you know, feel free.
You know what, and let me know if you want to send me your contact information and email. I can send you some of these documents. I mean, you know, there's good information, there's good marketing material available that speaks to these plans. I mean, if you missed it in my presentation, I can mail it to you.
Okay, Nora.
Whatever works. You want me to send it in the US Postal Service or electronically, it's totally up to you.
Well, I'll send an email to those people, including you, Brian, that have identified that they want to have further conversation with you. And like Tina said, she wants all the information that you provided on screen today. So I'll send an email out, and you know, you can go from there, and they can identify what it is they would like you to provide for them.
Okay, yeah, I look forward to it. I
Okay.
like when they see people having those aha moments, you know, where they say, oh, I get it.
Yeah, I mean, it's been a learning experience, but I think overall it's been very beneficial in our case and much simpler. And yeah, I'm going to stop the recording. When I get the link, I will send it to every participant that was here today. So, all right, anything else
Thank
before
you,
we?
thank
hang
you,
up?
everybody, for listening to me. I haven't
Brian.
done this in a long time.
Thanks so much for helping us learn about this, because I think it's a well-guarded secret.
Thank you.
All right, nice to meet
Very good.
everybody. Thank you for your time.
Thank you. Bye-bye.
Bye.
Well,